Bismillah ar-Rahman ar-Rahim. What I'm trying to do today or trying to teach is what we call fundoscopy or ophthalmoscopy. So this is a very important skill for doctors, junior residents. If you start learning early, there's a good possibility you will learn it in the next 1 to 2 years during the time of your residency. But in case you don't learn at that time, you can sure learn it later as well. But it's a key skill which is a little bit difficult to learn, but especially when it comes to neurology and neurosciences, this is a very key skill that everybody should know, especially if a patient who comes in with headache, the examination is not complete without doing fundoscopy. So there are many different ophthalmoscopes available in the market. The one I had since my residency days is the pocket one. It's a Welchland ophthalmoscope. It's not very expensive, but I started doing it a long time ago on this one, and I'm pretty comfortable with this. So try to have an ophthalmoscope in the start, which is relatively cheaper because it may drop from your pocket and get damaged, and practice on it. So when you come to the bigger, expensive ophthalmoscope, which gives you a better view of the fundus, at the same time you're pretty skilled with your smaller ophthalmoscope as well. There are many different settings on ophthalmoscope which everybody needs to understand, and I'll tell you about those as well after a demonstration of how I do fundoscopy. So when we start fundoscopy, I usually tell my patients to look straight ahead on the one spot. So usually I have something on the wall, so I'll ask my patient to look at that spot, and they can blink, but don't move your eyes. So I do this sign so they have an idea that they can blink their eyes during the procedure, but they shouldn't be moving their eyes, okay? So after that, I usually tell them to take off the glasses. So can you take off your glasses? Okay, and as a matter of fact, I have to take off my glasses as well so I can get close to the patient. The next command I usually tell my patients is that I'm going to get close to you. You can move your hair back. Okay, I'm going to get close to you and going to look into back of your eyes. So it will be really close. So don't be afraid, but keep looking on that one spot I showed you on the wall. Then I open the ophthalmoscope and turn it on and see what I'm looking at. Okay, so there are many different settings. Okay. But you start with the basic ones, and then you can go to the advanced settings of the ophthalmoscope. So there is a dial on the side which you can rotate to adjust the lenses to concave or the convex lenses. Again, that is to make the fundus look better or clearer. So that's what you are trying to do, and get a good view of the optic disc and then try to move around. And when you look at the optic disc, how you get to the optic disc is through following the retinal blood vessels. And the more prominent or obvious retinal blood vessels are actually retinal veins. So you follow the retinal veins to the optic disc, have a good focus of the disc, and then you try to look around the fundus and try to pick any abnormality. So by doing this, you adjust the lens to 0 before you go to concave or the convex, which appears as red or green. So you kind of put your hand on the forehead of the patient, and the way I do it, I put my index finger on the dial and my middle finger like this. And why I do it like this, because when I get close to the patient, my hand, which is on the forehead, gives me the idea how close I am with the patient. But at the same time, this finger also gives me the idea that I'm really close, okay? And sometimes it is difficult to put a hand, or the patient don't like putting a hand on their forehead or head area. So I put my hand there, lift the eyelid a little bit, ask the patient to look straight ahead, and then I look at the fundus, okay? And before I start, I actually turn off the lights. I'm not going to do it for sake of the video at this time, but I'll show you, because it will actually make the dilatation of the pupil, and it makes it easier that you can do the ophthalmoscopy and have a good view of the fundus without using mid-dressel eye drops. So you do it like that, ask the patient to look straight ahead, have a good view of the red reflex, and then you try to get close. And you have to be really close to really know the good view of the fundus. Now you try to follow the blood vessels. Okay, here I do see the fundus and the disc. I'm following the blood vessels, adjusting the dials, and then I can look at the disc margins. And I move around a little bit and look at the macula, which is like a red dot, temporal to the disc. And then I look at the blood vessels in all four quadrants. With undilated pupil, it is actually not easy to look around at the fundus. So I try to focus on the disc to have an idea if there is an increase in intracranial pressure or not. So this is kind of the basic, what I do. And then what I can do is I can actually move these settings to some different settings. So I can go to the target, and when you go to the target, you try to measure the distance of the lesion from the disc. Then you can go to the slit lamp exam, and you can look at the cornea, anterior chamber, and then you can look at the disc. This is not routinely performed in the clinic because naturally it takes more expertise. Then you can go for the blue filter. Let's turn off the light so I can show the. Okay, so this is the blue filter. Okay, and then blue filter is actually used to look at the corneal lesions. If there is any corneal abnormality, you can do the fluorescein testing to look for corneal abrasion or ulcer, and that will give you the idea. Then you can go to the smaller circle, okay, and the bigger circle, and then sometimes the ophthalmoscope may have a half circle that is used when you are looking at a patient who has cataract. So when you do that, you have to avoid that reflection from the cataract. So the purpose is when you do the half circle, you may defer that reflection from the cataract area. Sometimes we do use the green circle. Here we go. Turn on the light again, please. So the green circle or the green light or green filter, this is the one. And turn on the light again, please. So when we use the green filter, it is basically used to have a clearer view of a patient who has retinal lesion. Sometime in cataract it helps. Okay, so I try to do that, especially if a patient is having a reflection or the light is very irritating for the eyes. In that case, the green filter could be helpful. So that is when you're doing the right side of the patient, and the rule for the right side is right hand of the examiner, right eye of the patient, and right eye of the examiner. When it comes to the left side, when you come to the left side, you do it in a similar way, but this time it has to be left eye of the examiner, left eye of the patient, and left hand of the examiner holding the ophthalmoscope. So again, you're going to turn on the light, ask the patient, look straight ahead. You can blink, but don't move your eyes, okay? So you can look straight ahead on one point. And after that, again, you have to get a little comfortable with your left hand because that takes more skill. And then you kind of focus, and then you're going to get close the same way. Again, your middle finger pointing forward, your index finger on the dial, adjusting the lenses to have a clear view. So you do that and get close to the patient, putting your hand on the forehead and lifting the eyelid. Okay. So then you try to have a good view of the fundus. Again, with the left hand, it's not very easy unless you keep doing it. So you have a good view of the fundus, and then you follow the blood vessels to the disc, and then you move around to look at different quadrants if you can have an idea, or you can finish at the macula. Once you do that, again, patients examiners who find it difficult looking at the left side with their left eye because they are very much right side dominant, you can ask the patient to lie flat. When it comes to the fundus examination of the left eye, and you are not comfortable doing it with your left hand and left eye because some people may be very right side dominant, it becomes a challenge. In that case, the way you're going to do it is that you're going to ask the patient to lay flat and ask them to be more on the right side so you can examine the left side or the left eye, and ask the patient to look straight up at the ceiling at one spot. And again, you can blink, but don't move your eyes. And I also tell the patient that I'm going to examine the left side or the left eye, and they should be comfortable because I will be getting closer to them. So then you're going to turn on your ophthalmoscope, and coming to the head end, you ask the patient to look straight up to the ceiling. Sometimes you can bend the neck a little bit to make it more comfortable for you, because the comfort of the examiner is very important. Then you can lift the eyelid a little bit, look straight up, and with your right eye and right hand, taking off your glasses, you're going to ask the patient to look straight up. And you look at the red reflex, and then you try to go close to the eye. Okay? And when you do that, it's your right eye, right hand, but the left eye of the patient. Okay? And again, same way, you follow the blood vessels. You try to the disc. Once you have a good view of the disc, then you can move around to look at the macula and the rest of the fundus. So after finishing that, you can ask the patient to relax if you haven't been able to do it, or you need to work on it more to learn it better, because it takes a little bit of time. But once you will learn it, it will again become very easy for you. Again, try to have a patient on a little higher couch, because otherwise there's going to be a strain on your back. So that will be more helpful for you. Thank you very much.